Kyle. You guys are here at Cache Valley Hospital and you have an awesome, really fabulous wound centre. Am I right? Yes. I'm saying this right because it's a little bit difficult, it's like a tongue twister. But in that advanced wound care centre, you have a hyperbaric oxygen therapy facility, right? It sounds like a mouthful, and it's fabulous that we have it here in the Valley. Can you tell us about it?
Absolutely, Susan. Our clinic has been here around for about 10 years now, and what we use is we use oxygen in high doses, therefore hyperbaric, to increase wound healing in all types of wounds and problems. Okay. So what this does is we increase oxygenation inside the tissue with pressure. That's the key, is using that pressure under high 100% oxygen pressure to get the wound to start healing. Okay.
I was going to say, when I was looking at the picture of it earlier on, it looks a bit like one of those things that they used to put divers in so they wouldn't get the bends. Is that kind of the same principle?
Absolutely. That's where it originated from. Early on in the history of the world, they were building the bridges and they had to go down on the sea level and build the footings. And so a lot of people were getting sick, right, and they developed the bends. Okay. And from there it evolved and evolved and evolved into wound care healing, which is very effective and great today. Okay.
Now, Vanessa, tell me your role within this facility.
I'm the nurse supervisor for the wound clinic. Okay. So I manage a lot of the wounds, but we all work as a team. Okay. And when it's obvious that a wound isn't healing or that there's more that needs to be done, we start the process in getting them ready to go to the hyperbaric chamber.
Okay. So if you have a facility like this, am I right in assuming that this is something that's quite common? You sometimes get wounds that just don't heal as quickly as you would like.
Yeah, you know, in this day and age we're coming into the baby boomers and more people are becoming diabetic. Okay. So that's exactly what this clinic is directed toward, is the patients that have the comorbidities that lead to these wounds that become chronic and don't heal. Right.
So Kyle, who is going to turn up in your oxygen? And clever me for knowing that, by the way, right? The bends. Good for me for making the connection. Who's going to typically turn up at your clinic here? Vanessa mentioned people with diabetes, and obviously we know that people that suffer from that get these open wounds. But who else is going to typically show up?
We see a lot of people with circulatory disorders. Sometimes they have amputations or they have poor circulatory due to the diabetic process. Okay. So a lot of times the hyperbaric will help heal and oxygenate those areas that aren't getting the oxygen they need on a day-to-day basis to reperfuse and heal. Okay. So a lot of times we'll get those people with circulatory disorders. Sometimes we'll get people who've had radiation problems. Sometimes we'll get people that have bone infections. Carbon monoxide is another big one that we use to treat with hyperbaric oxygen therapy.
Okay. Regular diseases, if people's had surgery and it's not healing, would they come to you? How about that flesh-eating bacteria? We don't have a lot of it here, I guess, in Utah, but would they come here?
Absolutely. The necrotizing soft tissue infection is what it's known as. It's a great therapy for hyperbaric oxygen. Hyperbaric oxygen is a great therapy for that infection. Yeah. And so what we do is we utilize the pressure and the oxygen to help fight the bacteria with medical intervention like debriding and surgical intervention at times.
So, and you can probably see the picture behind us. That is the chamber, right, that you're laying. Typically, how long would you go in there for?
It just depends on what they're going in for, okay, and that also depends on what atmospheric pressure they're going in for and the time it's going in for the amount.
So it sounds complicated, which of course it is, but you guys you've been here for 10 years, haven't you, Kyle?
Absolutely. I've been here since the very beginning, and it's a great medicine that is on the verge of blowing up and having more indications and more therapies for people. They're looking into a lot of different things that I think are going to benefit the community.
So you guys really were pioneers in bringing this into Cache Valley, as the hospital has been with many different departments throughout the years.
Oh, absolutely. We've been the first hyperbaric facility. We're the only hyperbaric facility that offers 24-hour emergency care for carbon monoxide poisoning, or things like that, or crush injury. We've had a few patients, unfortunately, have a few crush incidences where we've treated them after hours as well, and hopefully saved a limb.
Okay, so giving people the information that they might need, and assuming that they maybe have to have a consultation or something to qualify to come in, but how do they get hold of you guys?
Typically, we have our website, cachevalleyhospital.com, is a great way to start, to get to know our facility, get to know where we are. And then we also have the main phone number of 435-713-1350.
And is that the actual hospital switchboard, or is that your department?
Direct to our department.
That's your department. And so anybody feeling, and of course I'm sure doctors refer their patients all the time, but anybody sitting at home feeling like, well gosh, I maybe need some of this, can they just call you direct?
Yeah, they can just call us direct. We have a great team that is just waiting to help them and is excited to see them every time. So.
And what a great opportunity. Now we have a choice here in Cache Valley, and this great, tell me again that I was going to read it, hyperbaric oxygen chamber?
Therapy, yes.
Therapy in that pod. That's very science fiction-ish, isn't it? But it's great that we have it here in the valley, because now you don't have to go to Salt Lake, you don't have to go to Ogden. You can come right here to Cache Valley Hospital. Thanks so much, guys.
Thank you.
Susan.